7 Signs your dog needs immediate medical attention. Part 1. When your pet dog is a treasured family member, you want to do everything in your power to keep him well and secure. While vaccines and vet appointments are necessary, there are also things to keep an eye out for in between visits. The last thing you want is for your dog to become really ill because you ignored a warning sign of a more serious problem. It can be difficult to tell whether or not your dog is in distress. Vomiting, for example, could signify anything from a minor stomach upset to a dangerous disease such as poisoning. Not to add that dogs are very adept at concealing their pain and symptoms from their owners. Pet crises are never enjoyable. Guessing whether your dog requires a same-day visit or can wait a few days can add stress to an already stressful situation. In nature, it can be self-preserving to minimize signals of discomfort and weakness. Therefore, signs of pain in animals can sometimes be subtle. If a problem is detected in its early stages, it's more likely to be treated and resolved with less expense, less difficulty, and a greater likelihood of success. Here are 10 top signs your dog needs immediate and urgent visit to the nearest vet hospital. Number 1. Bloating in the abdomen that occurs suddenly. Almost every dog gets bloated now and then. Bloating in dogs, on the other hand, is a different issue. Abdominal distension in dogs can indicate a variety of serious diseases, which is why it's critical to get your pet assessed if their abdomen begins to expand. The following are the top 3 potential causes of bloating in dogs. GDV, gastric dilatation and volvulus. Cushing's disease, peritonitis. Let's look at each one individually. Possible causes of the bloating. GDV, gastric dilatation and volvulus. Bloat, also known as gastric dilatation and volvulus, GDV, occurs when a dog's stomach shifts position in their body. The stomach inflates and may spin or entirely flip, interfering with blood supply to crucial organs, but that's not the end of it. This disorder can put dogs into shock and cause poisonous substances to be released, causing organ failure. Unfortunately, without early medical attention, this disease is usually invariably fatal. Bloat is treated by decompressing the stomach with a stomach tube or a big needle. Dogs will require surgery to fix any stomach twists and to clip the stomach to prevent it from happening again. To keep the dog comfortable and prevent subsequent diseases, IV fluids, antibiotics, and pain medicine will most likely be required. The prognosis is good if the dogs receive therapy immediately after the beginning of symptoms, but delays in treatment might be fatal in extreme cases. Peritonitis. Inflammation of the membrane lining the abdominal cavity, known as the peritoneum, can also produce severe swelling and pain. Peritonitis can be caused by a number of conditions, including infections caused by bacteria, organ failure, ulcers. Peritonitis in animals necessitates inpatient care and IV fluids, and some pets may require a feeding tube. If the vet feels chemical contamination is a problem or if there is signs of infection, surgery to flush the abdominal cavity may be required. During rehabilitation, dogs may be given a prescription food, medicines to combat infection, and pain relievers. Cushing's disease, also known as hyperadrenocorticism, is an endocrine disorder characterized by overactive adrenal or pituitary glands, which can result in abdominal swelling. Other symptoms include dull fur, excessive appetite and thirst, elevated cortisol levels, and exhaustion. Pituitary or adrenal gland tumors, as well as steroid misuse, can cause these symptoms. The majority of Cushing's disease cases are treated with drugs that control the amount of cortisol produced by the body. If tumors are present, surgery to remove them may be recommended. Due to the potential dangers and problems, surgery is normally reserved for dogs with adrenal-dependent Cushing's disease that hasn't progressed to other parts of the body. Number 2. Pale or white gums. If you discover your pet's gums have turned from a healthy pink to a pale white, you should take them to the doctor right once. The color of your pet's mucous membranes is an indicator of their overall health, and discoloration might indicate oxygen and blood supply issues. The following are some of the most common reasons of pale gums in dogs. Anemia is one of the possible causes of pale gums in dogs. Pale gums, lethargy, low appetite, and exercise intolerance are all classic signs of anemia. Anemia develops when an animal's blood contains insufficient healthy red blood cells to deliver oxygen throughout the body. A dog's body attacks its own blood cells in autoimmune hemolytic anemia, significantly lowering healthy red blood cell count and blood oxygenation. Internal bleeding, starvation, parasite infestation, disease, or recent toxin ingestion can all cause anemia. Fortunately, there are medicines available to cure many types of anemia. Transfusions of blood can assist increase oxygen and red blood cell levels until the dog's body can catch up. Immunosuppressants can help dogs with autoimmune anemia prevent further cellular damage. Anemia caused by underlying illnesses like as intestinal hemorrhage, poisoning, or malnutrition usually resolves on its own once the vet treats the underlying cause. Number 3. Rapid breathing, also known as tachypnea, in an adult dog is characterized as a resting breathing rate of 30 or more breaths per minute. This can be an indication of major, and perhaps life-threatening, problems. Some of the most prevalent reasons of fast breathing in dogs are listed below. Every dog pants on a hot day or after exertion, but they should not have difficulties breathing after a little rest or return to cool conditions. While your dog may merely have a cold or allergies, the severity of the illness can be determined. Possible causes of dogs' fast breathing: intense pain caused by disease or injury. Rapid breathing may signal that your dog is in excruciating discomfort, which could be caused by sickness or injury. If you observe your dog breathing heavily, wincing when you touch them, screaming out, or acting strangely, they're probably in pain and need to see a vet right once. The veterinarian can do diagnostic tests and imaging studies to determine and address the underlying issue. In the meantime, they will be able to offer pain treatment to keep your pet comfortable. Heat stroke. Heat stroke in dogs is characterized by rapid breathing, heavy drooling, vomiting, and poor coordination. If your dog exhibits these symptoms during hot weather, take him to the clinic as soon as possible. Anxiety. Rapid breathing isn't necessarily caused by illnesses or injuries. It might sometimes indicate that your dog is overly excited. Fireworks, thunderstorms, and veterinarian appointments can all cause dogs to breathe quickly or even hyperventilate. Pet parents may be able to cure anxiety in their dogs at home using remedies like as compression wraps, pheromone sprays, and other anxiety items. However, more severe cases may necessitate anti-anxiety medication or the services of a behavioral therapist. Number 4. Convulsion. It's terrifying to see your pet having a seizure, especially if they've never experienced one before. If your pet suffers a seizure and has no history of epilepsy, take him or her to the doctor right away because seizures can signify damage or structural abnormalities within the brain. Possible causes of dog seizures. Epilepsy. Epilepsy is a group of neurological disorders characterized by seizures. They can be caused by brain lesions, tumors, or damage, or they can be caused by nothing. Idiopathic epilepsy. If your dog suffers a seizure, they should consult a veterinarian to diagnose the reason and rule out any neurological problems. A veterinarian can also prescribe medicine to help reduce symptoms and possibly even prevent future seizures. If the vet feels brain tumors are causing their symptoms, surgery may be required. Trauma to the head. Brain injuries, such as falling, getting hit in the head, or being hit by a vehicle, can cause continuing seizures in otherwise healthy dogs. Disorientation, scratches, lacerations, and dental damage are also indications of head injuries. There may be no obvious symptoms, and pet parents may not know something is wrong until their dog begins convulsing. The nature of the injury will determine the treatment for brain injuries. Dogs with a large amount of fluid on their brain may require surgery or medication to lower the level of fluid. Pain medication and/or sedation are frequently required to make the dog comfortable as they heal. Please hit the subscribe button if you really like this video so far. It will encourage us to do much more. Thank you for watching. See you in the next video.